Thank you very much. Good morning, everybody. Thank you very much, Margie and Rockville Chamber for setting up these wonderful talks and also allowing me to speak. My name is Dr. Ashkan Aazami. I've been a practicing chiropractor since 1991. I started in Los Angeles and opened up the Landover Hills office in '95. And eventually the District Heights and Rockville locations on 121 Congressional Lane opened up years later. At Total Health Family Clinic, aside from managing everyday aches and pains, our main focus of care is on evaluation of traumatic injuries. These are from car crashes and also from work injuries. And our training has also placed us in a good position and experience to be able to serve as expert witnesses for these injuries. And this is something that we've done extensively throughout all jurisdictions in Maryland, DC, and Virginia. We are all physical, spiritual, and emotional beings. Rumi said, just as the water reflects the stars and the moon, the body reflects the mind and the soul. Why am I saying this? Last month, when I spoke about facts about whiplash, there were two studies that I had brought up that state that almost half of these injuries don't heal properly. And 45% of chronic neck pain in the US is due to whiplash injuries. So not being able to get these injuries properly cared for can definitely affect the individual as a whole. My goal today is to be able to shed some light on the types of treatments that are available out there for you. So God forbid, if you or your loved one are involved in one of these injuries, you'll be able to take care of them properly. First, what is whiplash? Well, what happens to the head and neck as your vehicle is struck? That quick motion that you go through resembles the tip of a whip. They found that these injuries are to ligaments, and ligaments are rope-like structures that hold the joints together. And as these ligaments are rapidly stretched beyond a certain point, the brain gets this information and then suddenly sends a message to the muscles around the area to go into a spasm and protect the joints. These are mechanical injuries. So when you have a mechanical injury, what is the best way to take care of it? Through mechanical means. Now, I'm going to go through a list of treatments that are available out there. By no means are they in any particular order. If you guys have any questions, again, just as before, jump up, chime in, and ask away. The first treatment that's available out there are painkillers and muscle relaxers. There's a number of different painkillers and muscle relaxers that are available out there. You have to realize that pain is just a messenger to you that something is wrong. On any given second, your brain is inundated with information about, from all your muscles, all your ligaments, all your organs, but you don't feel them. You don't sense them because they're all normal. Whenever there's an irritant that's present, it activates these pain fibers and you start feeling them. And that's the body's way of telling you that, all right, I'm away from my balance. Help me help you get your balance. Okay, and that's where these treatments come in. Now, as far as pain medications are concerned, the effects are obviously temporary. Why? Because you cannot have a pharmacological solution to a mechanical problem. And again, by all means, I'm not stepping on any of these treatments that are out there. And I believe the best way is to just try to figure out what is the best course to go. And that's the goal of today, basically. You guys have any questions about pain medications? No? All right, going to item number 2, which is rest. Rest pretty much in the past few years has been, as a treatment for these injuries, has been debunked. Again, it's not to state that rest is bad. What we tell our patients is you have to find that happy medium between digging a ditch around your house and creating a moat on a daily basis and plopping on your couch, on your bed the entire time. So moderation, find that happy medium. We had a patient recently who came in on a Monday morning and she said, Doc, I'm really bad. I'm in bad shape. Nothing's working. These treatments are not working. I don't know what's going on. I don't know what else to do. So I'm here calming her down, asking her, well, okay, tell me what happened. She said, nothing. I'm like, well, what did you do this weekend? Did you garden, do the yard, clean? What'd you do? She said, nothing. I was in bed the entire time. I'm like, what do you mean you were in bed the entire time? She said, I just got out to go to the bathroom and to eat. The rest of the time I was just in bed. And I'm looking at her, I said, well, even if I was not injured, if I was in perfect state of health, if I would do that, I'll feel as stiff as a board come Sunday night or Monday morning, let alone if you're injured. So find that happy medium, follow grandma's rule, moderation, all right? Any questions, you guys, about rest? Okay, thank you. Going to item number 3, which is braces, supports, and slings. Our office has pretty much not given any of these devices to patients in about 20 years. Why is that? And again, I'm not suggesting that there's no place for braces or supports. There's definitely a place if you do, or if you have or suspect a fracture, if you have or suspect a tear, or if there's any really bad disc herniations. There are some studies that show that braces and supports don't create dependency. But we've also noticed throughout the past few decades that it also has the position, potential to hinder improvements. So again, that happy medium between what is needed, and that's where clinically it is up to the individual and up to the provider to be able to help out. We have actually a patient that had gone to this orthopedic group, and every patient that came back from that group came back looking like Robocop. Neck, they had a support. Shoulder, there was a sling. Elbow, there was a support. Wrist, there was a support. Knee, there was a support. So the guy's looking around, looking at me. He's like, I don't know what's going on. I'm like, well, how do you feel when you take them off? He said, not very well. I can't move. I'm like, well, there you go. Our goal is to help you improve and strengthen your God-given, back brace, which is your core. This was actually brought front and center to us a couple of decades ago. We had our UPS guy that was delivering, a few packages, and I looked at him. I'm like, well, why aren't you wearing any supports? And he said, oh, they won't let us. And that's when I remembered, and I know I'm dating myself now, that Home Depot used to have those colorful back braces. They all stopped. Okay, and that's when I started looking into this a little bit further and realized that, no, this is what's happening. Unless it's clinically called for, it has potential to slow things down. And again, on some extent, create some dependency. Any questions about supports and braces? Yes, Margie.
About magnetic supports, because I know my husband has a really bad back, and he would put in a Nikken magnet in his back, but you're supposed to do it before you pick something up, not after.
Well, as far as, there's 2 parts to that question. As far as picking things up, the way you pick things up is the most crucial part of this. One researcher actually brought up something that, it was like a, Homer Simpson dope moment for me. He said, look at toddlers, how they pick things up. It is the most perfect squat possible, to the point that you feel like their butt is so far back, they're going to fall backwards, but they don't. So inherently, our system, our neurological system is set that way. But just like anything else, we just muck things up as we get older and older. So that's the first part, learning how to pick things up. And there's a few steps that are available out there. We tell our patients that you have to keep repeating these steps to yourself consciously, because when you keep doing that, your brain hates repetition. upper part of the brain. And the more you repeat something, it says, all right, apparently you want a file for this. And once that file is created, that's habit. So when habit kicks in, whenever you have to do something, quickly you go back to that habit. The other part of that question that you brought up was magnets. They've been starting to little by little understand its effects. And I'm always reminded of what one of my professors at school used to say. He went up to the board and he drew a little box in a corner. And he said, if everything that we need to know about the human body is this entire board, what science knows fits in that little box. And it keeps changing. And he's like, what am I telling you? Keep yourself humble because you don't know. Something that may not be proven. I mean, it's like proving pain, proving faith. You know, we can't do that, but we know it exists. So if it helps him, by all means, continue, all right? But learn the proper method because just in case, if you don't have that brace with you, your habit has to take over. Okay, so brace or no brace, your habit will take over. Any other questions? All right, going to item number 4, which is physical therapy. Now, physical therapy, as far as electrical stimulation is concerned, moist heat, traction, ultrasound, they all feel great. They help improve blood flow to the area. More blood flow comes in, brings in more nutrients, and helps the body start the healing process. But that's not it. There's further steps that are necessary because, again, we're movable creatures, right? And we have to have movement in there. Enter exercise. Now, exercise is an extremely crucial part of your recovery, but unfortunately, it's not done right. You don't know how many patients come in and say that, I was given this sheet of paper that looks like it's been copied 1,000 times at least, right? To do. I'm like, well, how's it helping? It's like, I don't know what it is. Some hurt, some I think feel okay. These exercises have to be individualized, right? We all have the same anatomy. We're all the same, but we all injure differently and we all heal differently. So if you are not followed up with these exercises properly, I'm like, let's say even if he had the same injuries, you may do it and you may feel great with it. I may do it erroneously. Form may be wrong. The timing of these exercises that I'm doing may be wrong. And I come back to my provider and say, oh, it still hurts. So it's like, all right, exercises didn't work, I guess. Let's try something else. It's not that exercises didn't work. It wasn't managed right. You have to learn how to manage these, all right? And at the same time, remember when I said this is a mechanical problem? One of the potential causes may be that why these injuries are not recovering properly may also be that, well, if it's a mechanical issue and you're strengthening it in a weak state, could that also be a contributing factor? I said these are ligamental issues. Research has shown that one of the treatments that is available out there that helps these ligaments actually get stressed, properly and heal properly are spinal manipulations and what chiropractors call adjustments. That's item number 5. In the US, 94% of spinal manipulation is done by chiropractors. 4% is done by osteopaths, and the remaining 2% is done by physical therapists. My aim today was to be able to, again, shed some needed light on what type of treatments are available out there for you. And a lot of times it's not just one single one. You may need a whole focus of things. And I'm, again, going back to what my professor said, which is you need the entire board. Okay, and it's not just single thing here and here. And it may help 1 or 2 individuals, but the other ones may need the whole ball of wax to be thrown in there. So again, my hope was to, introduce you to the type of treatments that are available out there for you. God forbid, if you have an injury that comes along, you'll be able to see what's available for you, make yourself whole again. And as Rumi said, reflect the stars and the moon. Thank you very much, everyone. Any questions?
Thank you so much. I love how you talk. I love the whole mind, body, spirit thing, because I totally believe it's all connected. So thank you. Does anybody have any questions?
That was great content. Thank you.
Thank you so much, Catherine. Thank you.
You can always copy the chat. If you see where it says to everyone in the chat, if you go all the way to the right, you'll see those 3 little dots. Click on those 3 little dots and you can save chat. Okay, so if you want to keep these tips. And this recording will be on the Chamber's website. And now I want to turn it over to Sharon Burke of Life Energy Foundation. It's our sponsor for Wellness Wednesdays. Thank you so much, Sharon.
Thank you.
So I just want to say, gosh, you are speaking our language here at the foundation. And I mean, you're 100% correct, because what we see and the people we work and serve and help are those that are having difficulty managing. They haven't found success. And one of the tools and resources we provide them is help in identifying from that board, maybe where the best place is for them to start to better, because you are so right. Everything. Oh my gosh, that's what we talk about, and why people come and find us is because they haven't found through other means. So thank you so much for all you do. This is why I sponsor this as the foundation, is we have to get this word out to people who need it. And in that vein, please share this group on Facebook. It's open to the public. So please, if you know of somebody that might be interested, we see the same people. We obviously all love this group. Let's share that love.
Definitely. I'd like to actually add one thing that goes piggybacking on what you just mentioned. We had 2 patients within a week come in who had injuries that dated back at least 12, 13 months. And they both were followed up with a very large entity here. I'm not going to name any names. And it's all been via telehealth. I'm like, has anybody touched you? No. And they don't know what's wrong with me. I'm like, no one's touched you and they don't know what's wrong with you. I mean, and it falls back on, us to try to figure out what to do. And, the body does have a window of healing. And the sooner you get to that window, the better.
And waiting for the studies to come out on the lack of hugging and how that's affecting our entire psyche and visceral healing. I mean, a 10-second hug can do so much to your systems, immunity, all that.
And how many people are going to really want to hug after COVID? I don't know. Maybe that.
Well, hopefully those folks who are pods can be, adding more hugging into their diet.
Like me, I'm like a hugging maniac. So my poor kids have been suffering because there's just more of it. The minute I can, I'm just going to be hugging everybody. Total strangers on the street.
Yeah. That's funny. That's one of my neighbors said that actually. He said, I don't care how many slaps I get, I'm hugging.
Well, thank you so much.
Note.
Thank you so much, everybody, for being on. Our next Wednesday, the 31st, is Josh Funk from Rehab to Perform. We had to postpone him last time because I had internet issues. So he's next Wednesday. So thank you.
It'll be the yin to your yang, Ashkan.
Yeah.
Josh is really wired.
Perfect.